Initially, when Tyreek Hill of the Kansas City Chiefs went down with a shoulder injury in week 1 of the NFL season, a lot of people couldn't really tell what exactly had happened just based on the mechanism of the injury. After the game, we since found out he's been transported to a hospital and is under the care of trauma surgeons after sustaining a dislocated SC joint. Welcome back, everybody. For those new, my name's Brian, and I'm a doctor and a sports fan, and this is your number one stop for everything sports injury and sports medicine related. In the video today, we're going to be talking about a super rare but really serious injury, in particular the SC joint dislocation sustained by Tyreek Hill. Make sure you guys go subscribe if you like this type of content and want to stay up to date with future videos as injuries happen in the NFL and around other sports. And let's get started. The SC joint is the sternoclavicular joint. It's the connection between the clavicle and the sternum, or the breastbone. We don't hear about it very often because it's rarely injured and has been estimated to account for roughly only 3% of all shoulder dislocations. But it's important to recognize that the shoulder complex is not just the humerus and the glenoid, or the scapula. The function of the shoulder is dependent on all these different connections, including the glenohumeral joint, the AC joint, and yes, the SC joint, which is the connection between the clavicle and the sternum. Whenever we move our shoulder, our clavicle is rotating as well, and that causes movement at the sternum. Part of the reason why these are so uncommon is just based on the mechanism of how shoulder injuries often occur. There's other joints that are more susceptible to being hurt first. When we go to the actual play where Hill got hurt, there really wasn't a clear mechanism of what happened. When we hear about AC joint injuries or clavicle fractures like we saw with Nick Foles, it's usually more of a direct axial load into the shoulder with the player landing on their side. Hill appeared to land more so directly on the front of his chest as opposed to on the edge of the shoulder. As we saw in the release from the Chiefs, Hill's clavicle displaced posteriorly, meaning deep or behind the sternum. Between this possibility and the clavicle being displaced anterior in front of the sternum, posterior is even less common. There's two different mechanisms to think about for how this can happen. The first is that a direct blow with high enough force to the front of the clavicle can simply cause that clavicle and those ligaments to shear and it get pushed deep or posterior to the sternum. The other mechanism involves thinking about a lever. And so if there's a direct load to the back side of the shoulder pushing forward, that can sort of lever the collarbone in a way that causes it to move posterior behind the sternum. When we see an anterior SC joint dislocation, it's usually because of a direct axial load into the shoulder, more like what we saw happen with Nick Foles. In this case, that posterior ligament is stronger than the one in the front, and so the anterior ligament breaks first and causes that clavicle to displace anteriorly. So why is this such a serious injury? Well, think about everything that lives in the body behind the sternum. Of course, you have the heart, but then you also have things like your airway and major blood vessels that leave the heart and return blood back to it. This is why these types of injuries are true emergencies in the context of orthopedics and sports medicine. We already heard that Hill went to the hospital and was under the care of trauma surgeons, and there's also going to be cardiothoracic surgeons involved in his immediate care. We also got the update that while he's not going to need surgery, he certainly is expected to miss a few weeks. So what do we do to manage and treat these when someone like Hill gets to the hospital? The primary method of treating these posterior SC joint injuries is what we call closed reduction. Closed meaning we don't actually have to cut the skin open and go inside the body to fix it, and reduction meaning trying to realign the joint. But this is extremely painful, and so when this is done, the person is often actually put under anesthesia so that they're sedated and aren't guarding and trying to stiffen up their muscles and aren't experiencing the pain associated with this type of maneuver. One technique to repair this is where they basically move the arm into 90 degrees of abduction out to the side, and then pull on the arm in traction, and then try to push it backwards into extension to, in a sense, lever the clavicle back into place. The other method is sometimes I'll actually try to grip on to the clavicle through the skin and pull it forward to get it back into alignment. You can imagine this would be extremely painful, and so that's why these people are often under sedation. Whenever this is done, there is typically going to be a cardiothoracic surgeon present just because of the high-risk nature of this procedure. There can be complications with damage to the airway and the blood vessels in up to a third of these types of cases, and so even if something isn't damaged, you want to have that surgeon there able to act in the room if something does get damaged during the process of trying to reduce and kind of repair this injury. But assuming everything gets realigned properly with no concomitant damage to the blood vessels or the airway or the nerves in that area, then there's no further surgery often needed. Players can return after a number of weeks from this type of injury. The Chiefs are estimating a few weeks, but you might read up to 6, just depending on how their pain and symptoms are after this occurs. So I don't expect him to miss the entire season, but we'll have to see over the next couple of days and weeks how he does in terms of pain, ensuring there's no complications, and then getting back his range of motion and strength. This is a really important lesson for us physicians when we see these types of injuries because they can often be overlooked in someone who's having shoulder pain that we can't explain. But it's a really serious thing that has to be addressed very promptly, and so I'm glad that Hill is so far doing okay and getting this checked out and taken care of. Thanks for watching though, everybody. I hope you guys learned something and enjoyed this video, and I'll see you in the next one. Bye.